So I just want to welcome everyone. I'm Allison Barlow, and I help co-direct the Circle Center of Excellence with Dr. Melissa Walls. I'm so sorry she can't be here today. She and I are both great fans of Dr. Blue Bird Jernigan, and so grateful she's here with us today. For those of you who might be new to Circle and what it is, it's a center of excellence that was funded by NIDA at NIH to really advance strengths-based approaches to substance use prevention and treatment with Indigenous communities. It focuses on Indigenous ways of knowing, of community-based participatory research, and really at the core, honoring the cultural strengths of Indigenous peoples who know best how to overcome substance use inequities that really are rooted in a history of racism and colonialism. So we are so happy. We have we're very fortunate to be learning today from Dr. Blue Bird Jernigan about multi-level interventions in Indigenous communities. And before we do that, Sheila's going to do a little bit of housekeeping and a land acknowledgement. So thank you.
Thank you. Yes, so at this time, we'd like to invite you all to share which lands you're calling in from. If you want to put it in the chat, or if you're unsure, don't have access to the chat, just invite you to take a moment to reflect or acknowledge the land or Indigenous peoples of your region in your own way. I'm calling in from Pueblos Tigua, Hiro, Dene, Nuchu, and Nade lands. And these are the lands that the Johns Hopkins Albuquerque office occupies. And these Indigenous communities have longstanding connections to this land, and their histories and their cultures continue to be significant with and around the present day settler state of New Mexico. And I remain committed to actively supporting these communities.
Thank you so much. So, as I was saying, I know that Dr. Walls and Dr. Warren and I all have such deep respect for Dr. Valarie Blue Bird Jernigan's work. She is really leading the field in nutrition, traditional foodways, and multi-level interventions. And I think it'll be a great talk today. So Dr. Blue Bird Jernigan is the director of the Center for Indigenous Health Research and Policy and a professor of medicine and rural health at the Center for Health Sciences at Oklahoma State University. She's been a principal investigator for more than a dozen research studies focused on cardiometabolic risk reduction and food systems change. She also directs the Center for Indigenous Innovation and Health Equity, an academic community partnership with Indigenous peoples to restore traditional foods and food practices and reduce chronic disease. Dr. Jernigan is also a member of many important national and international agencies that are advancing nutrition, health equity, and Indigenous science. There are many to mention from the American Public Health Association, American Society for Nutrition, Society for Prevention Research. She is on the editorial board of many important journals and is a member of the 2025 Dietary Guidelines for Americans Advisory Committee. She's also a member of the Advisory Council for the National Institute on Minority Health and Health Disparities. Dr. Jernigan received her DrPH from the University of California, Berkeley, and completed a postdoc fellowship in cardiovascular disease at Stanford Prevention Research Center. She also completed a postdoc fellowship in health policy at the Robert Wood Johnson Foundation Center for Health Policy at the University of New Mexico. She's an enrolled citizen of the Choctaw Nation of Oklahoma. So big warm welcome, and thank you so much for spending your time with us today.
Thank you, Halito. Chimachukma. I'm Valarie Blue Bird Jernigan, and it's an honor and pleasure to be talking with you all today. I'm going to go ahead and share my screen, and I will go ahead and get started. I hope that what I am going to share with you today is useful if many of you are substance use researchers. I think this might be relevant and interesting for you. I will focus on multi-level interventions with Indigenous populations, and we're going to share examples from my research center here in Oklahoma. Let's see. I want to acknowledge Yakoke, the Circle Center of Excellence, for this great invitation, Johns Hopkins Bloomberg School of Public Health. I have a couple of funders, National Institutes of Health grants that I want to highlight today. I wanted a special call out for the Intervention Research to Improve Native American Health, IRENA funding opportunity. It's a great opportunity for junior folks who are interested in getting funded under some of their mechanisms. And my partners, Choctaw Nation of Oklahoma, Osage Nation, Chickasaw Nation, and the partnering communities with the Center for Indigenous Innovation and Health Equity, funded under the Office of Minority Health, as well as Novo Nordisk Foundation. Those are the funders and partners that I'll be talking about some of our work today. Our center is located on Muskogee Creek Nation land, and that's where I'm calling in from today. OSU, Oklahoma State University Center for Health Sciences, is in Tulsa, Oklahoma. Our purpose is research, training, and capacity building, health promotion and disease prevention initiatives driven by community priorities and culturally centered strategies. We do CBPR, community-based participatory research, and tribally led research, and we have about 15 active research projects right now, and we're applying Indigenous methodologies, which I'll talk about in these research initiatives. That is our website, indigenoushealth.com, and our Facebook page. Please like us. We are trying to get more likes and followers, so I added that component in with a little thumb there, hoping to encourage our followers, new followers, and new likes. That is our logo at the top and a picture of some of our partners. And here's a little picture of my little daughter, Cedar, when she was younger. She has grown up now, much older, but she was once very sweet and cute, and now she is a teenager. I wanted to plug the Intervention Research to Improve Native American Health, IRENA funding mechanism. It's a special funding program. I hope it gets protected. It focuses on developing, adapting, and testing culturally appropriate interventions to improve health outcomes within Native American communities. They offer an R01, an R21, and an R34 grant. Check that out. It is great, and it's a good community of like-minded collaborators that you can work with nationally. Because I know many of us work in rural places, and we might not have a lot of colleagues at our universities. There's a strong emphasis with this funding on community engagement and culturally relevant approaches, and the focus is to reduce morbidity and mortality within the Native American population. I don't need to get into all of the persistent nutrition and health disparities when it comes to American Indians and Alaska Natives, but in general, you can see that food insecurity is really high in our populations. In the national population, it's about 10.5% in US households, and the prevalence among American Indians and Alaska Natives is about 45.7% nationally. It's much higher in some places, including Oklahoma, where our studies show 60% of American Indians and Alaska Natives surveyed were food insecure at our last survey. American Indians and Alaska Natives are nearly 3 times more likely to have diabetes compared to non-Hispanic whites, and 2.3 times more likely to die from the disease. And we're 50% more likely to be diagnosed with coronary heart disease when compared with non-Hispanic whites. I wanted to include an image of the food systems. It's a really simple model that I really like because of its simplicity. And this model comes from the high-level panel of experts on food security and nutrition of the Committee on World Food Security. And it gives you a sense of the food systems, food environments, and food supply chains. And so even though my focus was on chronic disease in my training and prevention and management of chronic disease, as I got out of my postdocs and into my own research, it was immediately clear that communities wanted to work on really big systems and food environment focus areas. And so if you look at this model, you can see food quality, production, availability, food storage and distribution, processing and packaging, retail and markets, availability and physical access and proximity, economic access. We worked on all of these over the last 15 to 17 years or so in our research studies. We didn't intend to work on all of these, but our work has taken us there. And I will share selected food system interventions: the Thrive Healthy Retail Intervention with the Choctaw and Chickasaw Nations. I'll talk about the FRESH study, which is a farm to school initiative in the Osage Nation, and the Osage Indigenous Supported Agriculture study. These are our RO1s, and they use community-based participatory research and their trials at the systems level. All of these studies are guided by the concept of Indigenous food sovereignty, which is the right and responsibility of Indigenous peoples to healthy and culturally appropriate foods produced through traditional Indigenous practices. Community members lead this movement. It's really a movement. It's not a public health theory or, a public health approach. It's really an Indigenous community-led movement, and it supports Indigenous communities in having greater control over land and food systems, and increases our ability to determine our own foods and protect our traditional and healthy foods. It also, from a public health standpoint, reduces dependence on packaged and fast foods. Indigenous food sovereignty addresses the need for nutrition and health equity approaches that are embedded within an Indigenous concept of health and wellness and self-determination, builds community strengths and cultural practices. So this is a first study that I wanted to share, and it's the Thrive study. It was funded by NHLBI. It's a convenience store study that took place between 2012 and 2017. This is an RCT of healthy food makeovers in tribal convenience stores in the Chickasaw and Choctaw Nations, which, if you look at the bottom of the screen, there's a map, and you can see the little red dots that are peppered throughout the state of Oklahoma, mostly in the southeastern corner. Those are the Chickasaw and Choctaw Nations, and there's a lot more dots now. That was kind of back when those were the number of convenience stores. There are a number more convenience stores at this point. Those pictures are pictures of the Choctaw, looks like that one is in Broken Bow, Choctaw Travel Plaza. And then the one on the bottom is in, I think, Atoka, Oklahoma. So these are places where Native people in this part of the state are shopping because of the lack of access to grocery stores in these regions. And so you can see that 60% of Native peoples that we surveyed reported shopping for food 3 times or more per week at these stores. And they have high rates of food insecurity and chronic conditions. So a practice of CVPR is start where the people are. And so that's why we decided to intervene at these stores, is because they were so heavily used by the population for food. We basically intervened upon the 4 Ps, as they're called, when you get into this kind of marketing work. and those are the product placement, promotion, and pricing elements in these stores. So if you look at the pictures on the far left, you can see what the stores kind of had initially in these locations. That's a hot box, as it's called, at the bottom left-hand side of the screen. It's really gross, deep fried food, if I may say. I think it's gross. I tried it. I eaten quite a bit of it. If you're eating that every day, you can imagine that you're not going to feel very good about, your nutrition, and just physically, you're not going to feel very good. And then the top is an image of the stay busy, get yours to go boxes in the Choctaw or the Chickasaw Nation. And those are, just quick bites, quick sandwiches, and you can grab your lunch there and get about your day. And the way that we kind of redid these stores, first, I should say it took us 2 years to gain access and develop relationships with store managers, tribal leaders. I want to emphasize that because this is CVPR. We didn't want to necessarily remove products or, make it feel and sound like the foods in these stores were not the right foods that people should be eating. Instead, we wanted to offer new and additional foods. And so that is kind of what our focus was. And the first thing that we had to tackle was product, because we really had to look at what is available, how is it being promoted, and what is it being, what is the pricing? And so you can look at how we sort of went about developing, once we got a list of existing products, and then new products that could be available as part of our intervention, which we had to work with the distributors as well as some of the producers at that, back through the chain, the food supply chain. And then once we got a list of foods, we pilot tested those foods, and we looked at what their pricing should be and how we should promote them. And you can see we created these shelf diagrams, and we created all the new foods that we were going to promote, and the ways that we were going to promote them, and then the 2 for $1 fresher option. So you can just see some of the signage, value choice and fresher choice. And we translated the promotion signage into native language. Achukmat Ashali is Choctaw. It means better choices have arrived. And you can see some of the food choices that we replaced the hot boxes, and kind of got more choices available to this population. The grilled chicken veggie wrap was a new offering that the Choctaw Nation created because they actually didn't have enough deliveries per week to keep fresh and healthy foods in stock. And so they actually had to expand their stores to develop an ability to have a food preparation component in the stores. And they added these healthy food options of salads and wraps. And value choice and fresher choice are also some of the promotion signage that we included. Fresh food destination is also listed as one of the promotional signs. We replaced those large hot boxes with open air coolers, and you can see kind of where those were placed throughout the stores, in the end caps and in near the cash registers. And the Thrive Study outcomes are published, but this is just a snapshot of some of the outcomes. This is a trend analysis of intervention exposure based on frequency of shopping. And so if you look at the columns from lightest to darkest, that's sort of the intervention exposure. So the lightest is less than 1 time a week shopping there. A little bit darker is 1 to 2 times per week, and the darkest bar is 3+ times per week. And you can see that the more frequently someone shopped there, the more dose that they received, so to speak, of the intervention. and they were more likely to notice the reach-in coolers, notice the fresh food destination signage on the reach-in coolers, and buy fresh fruits and vegetables in the reach-in coolers. And so there's that trend analysis, and you can see that the trends continue in terms of buying the salads and the wraps and the sandwiches, and their decisions to purchase the foods as well. Again, all of this is published. We publish our process, CVPR process, and we publish our CVPR outcomes. And so you can read about those in our website, has all of our papers listed there. Thrive increased both availability and the purchasing of fruits and vegetables and other healthy foods in both nations. And most importantly, it led to policy change at the procurement and distribution levels and store levels. So the changes that were made in these stores were made as permanent policy. And so we were able to ensure that not just keeping those healthy foods in the stores, expanding the intervention to the control stores, as well as ensuring that all of the organizations or businesses that both tribes owned, including casinos and hotels, were able to access the healthier menu items that were now available to both tribes at the procurement and distribution levels. And that kind of took us to our next study, the Fresh Farm to Head Start Healthy Food Study. And this one was a dream CVPR study in the sense that the tribal nation, Osage Nation, approached us with the idea that they wanted to repurpose land, which you can see Chief Standing Bear, the Osage Nation, is there in this area of land that Osage had. And they wanted to repurpose this land and use it for a farm. And they suspected that this farm would promote food sovereignty and probably lead to health improvements in their tribal citizenry, but they didn't really know how to design a research study that could assess key health outcomes that they might be interested in. And so we worked with them this grant was funded in 2016 to 2021, but we worked with them for several years before we got the funding. And then, we have continued to work with them. And we designed with them a multi-level farm to school waitlist control trial. And there were 4 communities with 9 Head Starts. 9 Head Start programs matched. The communities were matched by size, distance, socio-demographic characteristics. And that's how we matched the Thrive study as well. It was a similar design. The inclusion criteria, you had to be American Indian with a child enrolled in one of the Head Starts, age 3 to 5, and no plans of moving within the next year. So the idea was, as they start to produce food, which population of priority would they want to share the food and potentially, give access to the food and assess the benefit or the impact of that farm on that component of the population. And they chose the Head Start population because their priority was elders and children. Head Start was a sort of structured place to intervene with this initial stage of their farm, this initial stage of their production. I leave some of that detail out, but when you're doing these structural interventions, you're really looking at all other aspects of the structural change that you want to make. And so the population size and what their priorities are, and then the potential produce that you would have to grow to feed that target population that you have. All of that was done with agricultural partners and with the tribe, and in staged approaches to see how much they could produce in the first couple of years. And that was funded by a feasibility study. And then once we got the NIMHD funding, then we designed the Head Start study. Again, publications on that feasibility study are all on our website, and I'm not going into it here, but it's the structural piece of it that takes a long time before you actually even get to the health outcomes component of it, which is what the NIMHD funded. And so we designed a 16-week intervention with the tribe, and it went from Jan 2018 to December 2018. And it was Jan 2018. Well, that was the start of the recruitment. And then it went basically the full year. And there were 2 communities randomized to intervention, 5 Head Starts, and 2 communities randomized to the control group. Total participants were 193 children aged 3 to 6. Some of them turned 6 over the course of the year. Primary outcomes: increased vegetable willingness to try and intake in children. And there was a focus on some core foods that the community prioritized that they could, based on the growing season and their ability to produce those foods, and likelihood that these would probably be the foods that the children would be most familiar with and most likely to try. Remember that we were not experts on the Thrive Study marketing component. That did not stop us. We definitely were not experts on child intake of food. That did not stop us either. There are some really strange ways you have to measure intake of food with little children because you can't just ask them. So that's what willingness to try is about. So the environmental intervention, the structural intervention, was easy and fresh. It was the development of a tribal farm. At the time, it was called Bird Creek. It's since been changed to Harvest Land. We had a school level intervention where we changed the school menus and we replaced canned and processed foods with local vegetables. We changed the feeding practices to a family style, which is recommended by the Child Youth Head Start. There's a name for this stuff, and I'm sorry, I'm forgetting it. You can read about it in our publication. I cite it right there at the bottom, but there's a gold standard that these Head Starts aspire to, and it was recommended as part of that. Built school gardens. We built the school gardens at each of the Head Start sites so they could touch, feel, taste, and participate in the growing of these foods. And you can see at the top left corner, there's the kids, and that's one of our, that's our garden coordinator who worked with us. And we did a passive intervention with the family. I'm sorry, I skipped a bullet. We created an accompanying curriculum at the school. So the curriculum was in Osage language, and it included stories about these different vegetables in the Osage language, and it included, growing practices and encouraging willingness to try. And those are kind of, you can see they participated in the cooking as well. And those are the pictures of the little kids in the study. The family intervention was a passive intervention. Weekly meal kits were given every Friday with fresh produce from the farm. And they were encouraged, they had a little recipe and they were encouraged to cook the meals. And it was easy stuff like pizza or something that had a healthy vegetable on top. And there was a web-based parent curriculum and monthly family nights. For those of you who are interested in kind of native cuisine, we cooked at the family nights Osage versions of Sean Sherman's cookbook, which had just come out at the time, and it's an incredible cookbook. And we, the sous chef, and we serve those meals every month, and we replace them with key local herbs and different local produce from the area that was tied to Osage culture. And we shared kind of food stories as part of that. And it was really special because the Osage Nation has a particular cultural aspect that cooks are highly regarded in their tribal nation. And so it was also a place to really showcase and highlight these cultural, these knowledge holders. The FRESH study outcomes, here's a table of the differences in baseline and follow-up measurements of outcomes for children in the FRESH study. You can see the variable there, the dietary intake of the different tomatoes, carrots, spinach, squash, beans, and peppers, and willingness to try. And so then you can see the intervention group in the first column and the control group in the second column. Vegetable intake significantly increased in the intervention children compared to controls for squash and beans, and willingness to try scores increased for beans in the intervention children and tomatoes in both groups. We were very excited that the tribe adopted the farm to school intervention components as policy across all of the Head Starts. So the curriculum, the feeding style, and then most importantly, the healthy local produce replacing canned and frozen became policy. And the books were distributed, the curriculum stories and books were distributed across all of the Head Starts. And that led us to the presentation at the Osage Congress, where we shared the findings, and the Congress voted to expand their farm for another study that we have conducted, the Indigenous Supported Ag Study. Just a couple last pictures. That's the farm as it's, they have greenhouses now. It's really expanded. That's us presenting at Congress. I was there, very excited to present at Congress. I was just super excited to share this research. And that led us to the next study, which is an Indigenous Supported Ag Study, which we also partnered with them because we were really interested in the next sort of iteration of this farm and what it could do. You maybe know the term community supported agriculture. So we call this an Indigenous supported agriculture. CSAs are a popular food systems intervention, and they basically are, I've done them in rural California reservations. They basically take farmers and the local produce that they grow, and they provide it directly to the community who, community members buy shares of the CSA of the produce in advance, and that protects the farmer from, having to ship out all of their produce for fear that they might not sell it all. This ensures that they will, and it saves a percentage of that produce for the local population. And so we did that. We did it with the farm, and we basically created food boxes as part of a 16-week RCT to test an Indigenous supported agriculture's program effect on diet, blood pressure, and lipids. Blood lipids, those were our primary outcomes. Body mass index, A1C, and food insecurity and health status were our secondary outcomes. And at this point, the farm was producing quite a bit. And so the tribe decided that they would assess the impact of local produce boxes across the 16-week trial on individuals who have a chronic disease risk factor, and work with them to perform an economic evaluation. How much does this cost, and what are the potential savings at both the individual, organizational, and even community level outcomes? And then we are, we do a lot of videography and documentary work. And so we document and disseminated study processes and findings using participatory videos. I forgot to mention that we developed a documentary called Blood Sugar Rising that aired on PBS in April of 2020. I think it was 2020, and that was part of the last study. So we were doing another study with them, and we included documentary as part of this. And if you look, they have such beautiful written language. That's their written language. It's Go Healthy in the Osage language. And here's some pictures of the food boxes. And so you can see this locally grown fresh produce at the bottom left-hand corner. These boxes were amazing. It was a lot of food. and it was based on, the eligibility criteria. You had to be 18 to 75, identify as American Indian or Alaska Native, be a person who is overweight or obese, live in the Osage Nation, not plan to move, not pregnant or planning to become pregnant in the next year. And so the intervention components included this produce box, a healthy eating and traditional foods curriculum. That picture at the top right is a picture of the curriculum with some food on top of it. They got a cookbook in the curriculum, and it was in Osage and English. A kitchen starter kit. One of the barriers that we found in our feasibility and pilot testing for some of these foods and for the intervention in general was lack of access to food preparation tools. So we included that as part of the intervention. Healthy eating and traditional Indigenous foods cooking workshops. We did those every month. Indigenous cooking demonstration videos. And those were recorded and could be accessed. Another cool thing we did is we took advantage of one of their tribal members, Ben Jacobs, who owns Takabi Restaurant in Denver. He's an Osage tribal member. He has incredible networks that he uses to source his restaurant. And one of his goals was always to bring native owned and native produced foods to the Osage people. And so with our grant, we were able to pilot test that type of a project. And we added on a shelf-stable pantry box, which you can see, and it included food from all native producers from all over, different regions. And while it wasn't native to Osage necessarily, it was shelf-stable, healthy, whole foods that we included in their recipes that they could use as part of their produce boxes. And that was a one-time pantry box that we offered. And, it had wild rice, it had cornmeal, Navajo, pinto beans and blue corn. And, it was really cool that we were able to do that. And so that was part of it as well. And I am not going to share the tables with you, but it reduced A1C clinically, a clinically significant reduction in A1C. It improved dietary intake significantly, but it had a really, really significant impact on A1C. And so we're writing our paper up right now, but we're really excited to share the findings. And that was in the intervention group, obviously, when compared to the control group. So those are the findings you hope to get, and we're really excited because it was equivalent to medically supervised treatment of diabetes with this intervention. And the last piece I wanted to share, Center for Indigenous Innovation and Health Equity, CIHI. I will tell you that we've already had our name changed to the Center for Indigenous Innovation and Health Excellence. That was done at the government level, and it will read that when it comes out again for application for funding. That was not a change that we made. It was a change that was asked, that it be listed differently. And so there, that's a big difference for us. But that is supported by the Office of Minority Health, and Novo Nordisk Foundation funded a smaller study in Oklahoma that is called Indigenous Foodways and Health. It's the same model. It's just native tribes in Oklahoma. Our initiative our genealogy of this program is really rooted in ceremony and tradition and modern practice. And we say that because this is a picture of our partnership in Hawaii. And we came together as part of a NOHO, or kind of a partnership to engage in sitting and thinking together about what we could do to support our population in food sovereignty. And that is how we dreamed up the CHE initiative. It wasn't called that, but eventually we got that funded. And so there are two sites. There's one in Hawaii and then our site here in Oklahoma. It promotes research, education, and training on food sovereignty and health among American Indian, Alaska Native, Native Hawaiian, and Pacific Islanders. And last year, it's 2023 now, we published Food Sovereignty and Health. An introduction to the focus issue that's the link there for that publication. But we published about 12 articles as part of a special focus issue that describes the different interventions across the country. And these are our sites. So we initially were 4 studies in Alaska and Oklahoma, American Indian and Alaska Native. And then we expanded to include more sites in Alaska and multiple additional sites across Washington State and Yurok and Indian Health, Turtle Mountain, Dream of Wild Health, and then a number of partners here in Oklahoma, Osage, Choctaw, Quapaw, Muskogee Creek, Chickasaw, American Indian Resource Center, which is in Cherokee Nation, and Burning Cedar, which is a local urban nonprofit. The purpose, identify and uplift Indigenous food sovereignty initiatives. We use a decolonized Indigenous approach to measure the impact of the work. So we're looking at things across tribes, like what does it mean to be a good relative in a research partnership? And those are kinds of the questions that we ask among ourselves, and we try to look at across our different communities. Document Indigenous food systems and stories to support the transmission of generational knowledge. It's really important to document the food systems and understand what are our traditional food systems and stories, and what are these plant relatives trying to teach us, and support and strengthen place-based knowledge. We included this for people who are into models. And if you're a researcher, you're probably into models. I'm into models. And we did this one. How does Indigenous food sovereignty directly relate to health? That was a question we wanted to ask within the literature. Left-hand column are food sovereignty activities and level of influence. And so we asked elders and we asked community knowledge holders, what are food sovereignty activities across all of these communities? And we got different answers. And so we then categorized those answers, those activities into different sort of, I guess, levels: individual, family, community, and land and place. And we sort of, they overlap though. And then we asked the knowledge holders in these focus groups, what do you think are the potential effects of these activities on the population? And that's what, the middle column, proximal effects and distal effects. And that's how we categorize them. And I won't go into all the details, but you can read this in that focus issue. And we posit that these are the impacts of these food sovereignty activities. And a lot of this is one of our partners is Jessica Ulrich, and she has the connectedness model. And so we were looking at what is the underlying sort of mechanism of action here, and it's connectedness. And then we also talked with Melissa Walls when we saw her presentation at the Native Nutrition Conference around the potential of, I think it was cultural efficacy. The growing of your own foods really restores those connections and gives you a sense that you belong and that you have the ability to practice your culture. And growing a garden can help you to do that if your tribe is agricultural like mine, just as practicing your language and relearning your language. And so these are kind of the underlying theories that we've posited and sort of, asked that this be a iteration that others build upon. Couple of examples of our projects. Growing Hope is a restoring traditional Choctaw gardening initiatives. This is my tribe, Choctaw Nation, and our project looks at the distribution and education of tribal members, we are given traditional heirloom seeds that were carried over from the Trail of Tears. And those seeds have stories, and the families that held on to those seeds and carried them brought them, and they shared the stories of the seeds. And the seeds are handed out as part of this program, and participants are taught traditional planting methods, food stories, and food preparation and preservation, and really supported in growing a traditional garden. And so that's where we get a lot of the seeds. On the bottom right is one of the gardens where these seeds come from. And that's the Three Sisters mounds you can see growing there with squash, beans, and corn. And our outcomes are going to be both clinical as well as behavioral and cultural. And some of the outcomes that they've piloted it are looking at our food security, dietary intake, blood pressure, potentially blood lipids, and self-reported health. Chickasaw Nation is developing a traveling garden mobile market. Fresh fruits and vegetables are sourced from local farmers that will be distributed in 8 low food access communities. They're going to pilot the program to their WIC program recipients. That is going to help build sustainability and long-term support of the program. They will partner with SNAP Ed for on-site nutrition education and virtual cooking demonstrations with their traditional foods. And they're also looking at some clinical as well as cultural and behavioral outcomes. South Central Foundation in Alaska, they've hosted a traditional food gathering. The last one they hosted was last August, and they held 27 workshops hosted by 38 speakers in 3 parallel tracks. The purpose of this was really to capture these processes in real time and communicate to, community members what this traditional food knowledge is, and be able to kind of have it in one place and have the communities have access to it. And so that's what they envisioned for their food gathering. They recorded it, and they had workshops that they video recorded, and they had most of the regions of Alaska represented, and they conducted pre and post evaluations. They offered continuing medical education credits to all of the participants. Their outcomes that they actually analyzed, they saw an increase in knowledge of traditional foods, and they want to expand this to focus on changes in both knowledge and practice. And they're currently planning their next one right now. Osage has a mobile market, kind of a similar, sort of approach in expanding their farm. They wanted to reach partners that may not be able to access that farm, community members who may not be able to access it. And so the farm is located in Pawhuska, but they have other towns and villages across their reservation. And so they want to take the mobile market, and you can see a picture of that market, to the out of Pawhuska to different areas. And they're looking at changes in food access, intake, and food security, self-rated health. They want to add clinical measures as well. Denakanaga culture camps. This is elders mentoring elders. This teaches traditional foods, knowledge, and practices with an emphasis on residential school survivors and families. So these are elders who went to residential school and didn't get to learn their traditional practices, and then elders in the community that know their traditional practices but didn't get to teach. And so that's what the camp focuses on, really restoring those connections. Outcomes are social and emotional well-being, cultural connectedness, self-reported health, and dietary intake. And that one is really focused on a lot of levels as far as just the different knowledge of the food systems, but also cultural practices. So those are just some examples. The key learnings to date: CHE programs use a decolonizing approach to what we call access to pre-colonial mind. And that's what Vanessa Watts, scholar and Canadian scholar, First Nation scholar, talks about. when you're doing these food systems, food sovereignty initiatives, really are able to access not just, stories, but you access a lot of generational knowledge. And we value story as a primary method for collecting and sharing knowledge. And so we do participatory video and participatory documentary. Partners make stories, and we use stories to document changes over time, to really get a visual depiction. And you can see these farms, just the land being prepared, the planting, the growing, and then the harvesting process, and then the cooking process, and the relearning your, ways to prepare your traditional foods, and the sharing it with your family. We center self-determination as fundamental to the health of Native communities. We have to be able to determine the strategies that make us healthy, and to restore our own cultural practices. And we place that as central to all of this work. So this is a picture of us, and I will love to take any questions you have. And Yakoke, thank you very much.
Thank you so much. Oh my goodness, the scope and depth and practicality of your work is so beautiful. So thank you so much for presenting. We'd love to take questions. So pop them in the chat. I just wanted to repeat something you said that really moved me, and you repeated it a couple of times. You mentioned things that maybe you didn't know exactly how to do something before you started, but you said that did not stop us. And I think the challenges are so big that you just have to start somewhere and not perseverate on perfection. So I don't know whether you could speak to that a little more. I just think that's a really important message for this group.
Yes, I think that we don't get the training that we need to do some of these structural changes in public health, but we also have certain practices in our cultures that are, when you ask for help, people will help you. And so we ask for help, and we listen, and we ask what would make this something that would be done in a good way, in a right way with this population. People will help you. And so we just humble ourselves to the feet of the feet of these, community experts. And they're like, okay, we'll help you. And so, and also in the tribes, sometimes there's a lot more, at least I found, there's a lot more, you can always find key things that you have in common. And so, like, we worked with government leadership, we found the things that were important to them, and we could offer them marketing research. We could offer them agricultural knowledge on numbers of food that they could produce. We could bring those resources to them, and that's what we can provide as a university. So what we can bring, we bring, and what they can bring, they bring. And so that's why we've backed away from projects, though. We have said, like, I can't do that, but I know someone who can. So we do that when it's not something we can do.
Yeah, that's awesome. Okay, there's a question from Mercedes. What would be a good resource for smaller rural communities that don't have a school as sort of a launch pad for some of this work?
Well, there are individual researchers you could reach out to, and then there's big, large universities like Johns Hopkins that focuses on sharing a lot of their knowledge through dissemination. That's a key, we get a lot of knowledge from other partners who've done similar things. And so going to these conferences, if you can, checking out the websites and the publications of some of the university partners, reaching out to university partners and saying we might be interested in doing this in our community. Are there any resources? I get a lot of emails like that, and we connect them to small grant opportunities, and we support those ourselves. We have pilot funding that we distribute as part of the different funding resources we have. So those are some strategies. And professional organizations that do this kind of work, like Intertribal Ag and First Nations Institute, things like that. You can reach out to those groups.
Excellent, thank you. Brent has a really interesting information in the Q&A, and I'll briefly review it, but he's asking if other states are using similar strategies that tribes can take advantage of. So in New Mexico, food security is high, particularly in rural counties where indigenous reservations and pueblos exist. There's a regional farm to food bank grant that partners with small farmers to sell premium, highly nutritious, locally grown foods. Foods are purchased with a grant, USDA funds, and given out freely to qualifying participants at their local pantry. This grant helps support local farmers, local economies, etc. Additionally, many farmers markets have a program called Double Up Food Bucks, where people with SNAP benefits can purchase food at those farmers markets at reduced rates. And he's asking, Valarie, do you know if there are other states are using similar strategies that tribes can take advantage of?
I do. And Intertribal Ag has a whole list of things, and so does the Indigenous Food and Ag websites. I would check those out. Some of that is getting cut, but some of it is still available, and that changes day to day. But there's a lot of small grants that are still available that you can get.
Yeah, and I think we will see private foundations moving faster into this space as a result of some of these cuts. So we all need to help each other with those resources. It's 5 o'clock. That went really fast. I want to be sure, Dr. Jernigan, we respect her time, but is there any final question? And someone did ask, I think we recorded, Shayla, is that right? Did we record it and we'll post it to the Circle website?
Yeah, everyone will get like a follow-up email with the recording and if there's any other like supplemental materials.
Excellent. Thank you so much.
Thank you all so much.
Yeah,
Appreciate it.
you're getting lots of props in the chat, so I hope you can see it. But thank you so much.
Thank you. Take care, everybody.